Hello everyone. Today I'll be discussing a topic of middle ear, which is one of the most difficult topics of first year. We're going to be simplifying this diagram. I am Dr. Swapan Singh from School of Medical Sciences and Research, Sharda University. So let us begin with this topic. Our ear is divided into three parts: the external ear, which comprises of the pinna and the external auditory canal, a middle ear, and an inner ear. Now, the junction between the external ear and the middle ear is made up of a membrane known as a tympanic membrane, which separates the external ear from the middle ear. We're simplifying this middle ear. See, now the tympanic membrane is lateral to the middle ear. So now we're opening this, we're assuming this middle ear to be a box. We're highlighting a wall here. And this wall is the one that contains tympanic membrane, which is present laterally. Now, let us think it as a door, and we are opening this door. So automatically, as soon as we open the door that is lateral, the wall that is opposite to it becomes the medial, and thereafter there will be an inner ear. So now let us draw this diagram further. So this was the box, this is the inner. Now we have entered the box, and this is the door. Again, I'm drawing the door. Automatically, the above one will be the roof, the one below will be the floor, lateral containing the door, the medial one, the anterior, and a posterior. Posterior is the one that is connected to the mastoid, which we'll discuss further. Beginning with the roof. Above we have brain. What brain? What part of the brain? Temporal lobe of the brain. Covered by the meninges. What are the meninges? Number one. This pink colored one is the pia mater. The blue colored one I'm drawing is the arachnoid. And the green colored one that I'm drawing right now is the dura. These are the ones that cover the roof. The roof is also known as tegment tympani. Tegment tympani. Come to the floor now. The floor is made up of a vein. Very important vein, the internal jugular vein. And not just internal jugular vein, a superior bulb of internal jugular vein. And there arises a nerve, which forms the plexus. Now, what is this nerve that is arising? This is the tympanic branch of ninth nerve, glossopharyngeal nerve. Plexus will be the tympanic plexus. Where is this plexus formed? On a structure which we'll discuss later. Coming to the anterior wall, A for anterior, A for artery. Which artery? Internal carotid artery. And all the artery of the head and neck have a sympathetic plexus around it. So internal carotid artery. Two canals are also present anterior wall. One is for the tensor tympani and one is for the eustachian tube. And between the two, we have a hooked process known as the processus cochleariformis. So we'll revise this quickly. The roof is formed by the temporal lobe, pia mater, arachnoid, and dura. The floor is made up of superior bulb of internal jugular vein, giving rise to tympanic branch of ninth nerve, and then the tympanic plexus. Anterior wall has internal carotid artery, canal for tensor tympani, eustachian tube, and processus cochleariformis. Coming to the lateral wall, we know that lateral wall has tympanic membrane. So this greenish structure that I am drawing right now is the tympanic membrane that is separating the middle ear from the external ear. Now, two ossicles are present here. One is the malleus, one is the incus. Malleus is hammer shape, incus is anvil shape. We have stapes as well, but stapes is stirrup shape and it covers the foot process of it covers the oval window, which we'll show in some time. Talking about the posterior wall. From the roof arises a nerve, not a nerve, rather a canal. This canal has two parts. This is the canal that I'm drawing. It has two parts. A horizontal part. So this is the horizontal part and a vertical part. The vertical part is present in the posterior wall. This canal is known as the facial canal because it contains facial nerve and it gives a branch here, a branch which is known as the chorda tympani nerve, which will supply tongue and further structure, which we'll discuss later. Chorda tympani nerve. Also on the posterior wall is a structure that is pyramid in shape, a bony structure which is pyramid in shape, and a muscle is attached there. So I'll draw that pyramidal structure. This is the pyramidal structure, and we have this is known as obviously pyramid because it's pyramid in shape, and it is a muscle here which is known as stapedius. So two muscles, tensor tympani anterior wall, stapedius at the posterior wall. We know that on the posterior wall Posterior wall connects it to the mastoid, middle ear to the mastoid. So this is known. There is an opening, and this opening is editus ad antrum. That is an opening to the antrum. And what is antrum? Antrum is the largest air cell of the mastoid. So any inflammation there, any infection there will be known as mastoiditis. Finally, coming to the last wall, the medial wall, it has two openings. One is an oval-shaped opening known as oval window covered by the footplate of stapes. One is a round window, round in shape, covered by a secondary tympanic membrane. Now the structure on which the tympanic plexus is formed, this is known as promontory. We know that medial to the middle ear is inner ear. So inner ear has cochlea. The cochlea has two 3 by 4 turns. So the first turn of cochlea forms a bulge on the medial wall of the middle ear, which is known as promontory. So promontory is an elevation or a bulge on the medial wall due to the first turn of cochlea. Now, whenever there is, now we'll discuss something clinical. Whenever there is infection of the middle ear, it is known as otitis media. External ear is externa, otitis externa, middle ear is otitis media. In children, the roof is not formed properly. As a result, any infection in the middle ear, it can go into the brain. It can irritate the meninges. And this irritation infection of the meninges is known as simply by the term meningitis. Anywhere where the word itis is used, there is inflammation, meningitis. One more thing. There is a structure, tympanic membrane is there, and tympanic membrane has a nerve there. So when we perform a procedure known as myringotomy, myringo means tympanic membrane, otomy means opening, we can damage the chorda tympani nerve. One more clinical significance. This facial canal opens somewhere at the base of the skull. It opens in a foramen which is known as stylomastoid foramen and further supplies the face. Finally, the contents. The major content is air. The middle ear is completely filled with air. We have two muscles, stapedius and tensor tympani, stapedius posterior wall, tensor tympani anterior wall. Ossicles, malleus incus, the footplate of stapes on the oval window. And finally, the nerves. We have the ninth nerve, tympanic branch, tympanic plexus, and we have the seventh nerve with the chorda tympani nerve. I hope I have made this topic simple for you. Thank you.